Hey there, my name's Kyle, and today I'll be doing perineal care, or essentially I'll be changing this mannequin's catheter today. Starting with perineal care. So prior to that, you want to start off with everything you were going to do. Check your hospital guidelines to see what you can and cannot do. Get your patient's consent. Hey, I'm here to change your catheter today. Do I have your consent? She agrees. So prior to all of that, you'd want to practice proper hand hygiene, don the proper PPE, which is contact, assuming to be masks and gloves, which I will be donning soon, and most importantly, valuing patient privacy. So before we begin, you always want to remember to close the curtains, because no one wants to see all of that. And they definitely don't want you to see all of that. So beginning with the first step, I will be donning gloves, though it isn't necessary. Personally, this is my own pick, but let's begin. Starting off with the sterile field, taking it towards itself, and opening it away from you, taking to the sides, and as I did not notice, I will move one thing out of the way. Just put it there. Grabbing the tweezers and gently rotating it back into a square, into the center, and placing it outside, or just in between the 1-inch border. Continuing on, we would be grabbing the lube, and prior to moving the tray over, we want to set the lube up right on the side. I don't know if you can see it, but I swear it's there. Prior to that, before doing everything, we'd want to take the wrap, open it up banana peel style, and with your tweezers, take it out of the packaging back into your sterile field. And put that thing down, and discarding of it as such. And prior to that, you'd be taking the orange side, unscrewing the cap on your syringe, and screwing these two pieces together. Moving on from that, I will now don my gloves and don sterile ones as well. And then after, I'll be donning my gloves, making sure everything is in order, grabbing the 1-inch border, and prior to bringing it over, I will lift the bed to appropriate working height and placing the patient into a form of Fowler's. I believe this is high Fowler's position, just so they can spread their legs properly for the most comfortable use. And bringing as such, grabbing the tweezer and the thing back over here, because I forgot one thing. I will be placing pads onto the patient. So, using the technique, with a thumbs up, you'll be inversing and dropping down the pad as such. And then with the top pad, you would take the line straight atop, again, with your thumbs up, pulling in and placing it over the pelvic area. Once it is placed, you would then grab a drainage basin just to catch any excess falling from the perineal care. Now you would then take it by the 1-inch border and bring it slightly over. With this 1-inch border in the way and this poured in, of course, since it's an empty bottle, you would open it, lip it into the garbage, then pour the rest in there in order to avoid contamination from any lingering bacteria. Prior to that, take the tweezer and your thing, and with one cotton or gauze, dip it into the solution from top to bottom, midline, from top towards the anus, and discarding. And we do that 2 more times. One again, dip into the solution from the top to the bottom, and discarding. Once more, taking it from the solution into the midline, top to the anus, and then discarding. Prior to that, after using the cup and the tweezers to touch a specific area, you would then want to discard of it into the garbage as well. Now, what you want to do is you're going to take the tip of the catheter rub it on the loop prior to inserting, and with your dominant hand, place the catheter in your hand, your least dominance, spreading it open. Then inserting 12 to 27 centimeters, I believe is the thing. You'd want to push until resistance or until you start seeing urine. In the case you started seeing urine, just push it 2 more inches just to make it in there. Then with one hand, spread open and one pushing in, you'd want to inflate the balloon as such. Then just to make sure to give it one gentle tug to make sure it's fine, which is fine. You would then want to remove this, place it back, and connect it. Right in here. Back to that. Since everything is connected, you then want to rip it apart. But for this case, I won't rip it because we were trying to save it. I'm gonna pretend like I ripped it. But I ripped it, and then slowly taking away any extremities as well. Taking away the basin, and as well as the under sheet. As soon as you're done, you would then tell the patient that the procedure is done, and if there's anything else she would like to need. If the answer is no, remember to tell her where the call bell is and return her back into an appropriate position where she feels most comfortable. Would you like to lay back down? Head down? Oh, that's the way. Oh, there you go.